Bismillahirrahmanirrahim. I am Dr. Sayyid Raza Mohiddin, member visiting faculty, Times Institute, Multan for MPH classes. And today is the seventh lecture on health promotion, health education, and communication. Today we will learn the different concepts in health communication and promotion. And for this, we first start with the, you have learned the health communication. It's a two-way process. There is a sender or the health promoter. The on the other side is the audience or the receiver. That can be a single person, a community, and or the masses. And there is a message, that is the information we want to share, and in all that there is a feedback. And for this effective communication we use either it is face to face or we use media. If it is a small gathering, we can just address vocally, and if it's a large gathering, a megaphone or a speaker can be used. And if there are large of people or a seminar, then different audiovisual aids are used. But for TV and radio, mass media campaigns are also there. Sometimes we have to move from our place to go to certain areas, so we have to use the vehicles and other campaigns, the loudspeakers. So there are different health communication strategies and principles, and there are certain concepts, and we will study that concepts today. You are all familiar with the audience, you are familiar with the message, you are familiar with the producer or the sender. But today we will learn the different concepts, and the first concept is health comms 5-step methodology. This is the methodology of communicating the information, and it is this 5-step methodology is the first step is the assess the public health situation, target audience and their environment, current and proposed health behaviors, program, resources and constraints. So this is the assessment phase. We assess what is the situation, and then we see to whom audience or message should be given, and in which environment, and what behaviors or what message we have to tell, and then what resources we have had, and what are the barriers or constraints in that methodology. Then first we make an assessment, then we plan. Then the plan is the public health intervention based on data on the health issue. So the data available is very important. Then we plan on the type of audience, number of audience, the communication channels, and the available resources. Again, first we assess all these, and then we plan the intervention. And this intervention is based on the first phase, that is the assessment. The third is draft, pre-test and produce. The appropriate print, audio, video and counseling materials are just written and drafted. Then fourth stage is to deliver the health communication programs in tandem with service delivery groups. So this program is delivered. Then we monitor and evaluate to determine how well the program is being implemented. Whatever we do, where we use our human resource, we use our other financial resources and other resources, so we also monitor and evaluate the effectiveness of the program and the right use of our resources. So we make mid-course corrections in strategy of the material. So there are always, certain corrections have to be made in our program in the midway or in the end in some other program. So we use mid-course correction in strategy and materials, and assess the overall impact of the program and its constituent parts. So this HealthCom 5-step methodology is simple assessment, planning, drafting, delivering, and then monitoring and evaluation. And then again, it is the feedback when we have some negative feedback from any side, we correct it, and then we again start the program. So this is HealthCom's 5-step methodology. Then is a frame of advocacy. So the frame of advocacy is a 6-step campaign program. The first is the analysis. The first step is effective advocacy, starting with accurate information and in-depth understanding of the problem, the people involved, the policies, the implementation of non-implementation of these policies, the organizations and the channels of access to influence people and the decision makers. We are advocating the communication. Then is the strategy number 2. The strategy phase builds on the analysis phase to direct plan and focus on specific goals and to position the advocacy effort with clear paths to achieve those goals and objectives. Then third is the mobilization. Events, activities, messages and materials must be designed with your objectives, audiences, partners and resource clearly in mind. Then fourth step is the action. Keeping all partners together and persisting in making the case are both essential to carrying out advocacy. Then again, like the other frame methodology, it is the evaluation. A team needs to measure regularly and objectively what has been accomplished and what remains to be done. And then the sixth one, the last one frame of advocacy is the continuity. So this continuity, it articulate long-term goals, keep functional coalitions together and keep data and arguments in tune with changing situations. So these are the two concepts. Now there is another concept, the P process. What is a P process? The P process was developed in 1982. The P process is a tool for planning strategic, evidence-based health communication programs. More than 30 years later, communication professionals around the world were using the P process to design, implement, monitor and evaluate communication strategies, materials and programs. The P process, it is a framework designed to guide communication professionals as they develop strategic communication programs. The Health Communication Partnership addresses family planning, maternal health, child survival, HIV/AIDS, and other infectious diseases such as malaria and tuberculosis. Then we see the original P process. The P process, which is the old one or classical. This was like this John Hopkins Bloomberg School of Public Health Center for CCP and in partner in USAID Supported Population Communication Services, they developed the program and as a tool for planning strategic evidence-based communication campaign. Then the 2 decades later, P process continues to influence the development, implementation, monitoring and evaluation of numerous communication strategies, projects and programs, as well as communication material and tools for mass and community-based media, interpersonal communication and counseling, and training and capacity strengthening in strategic communication. Through numerous communication interventions, the impact of the P process spans the globe. And this P process has, it is, 5, it is like a UCP, and on the first is the analysis, The second on the shaft of the P is the strategic design, and the third is developing pre-testing productive production. Fourth is management implementation and monitoring, and the fifth one is impact evaluation. This is P process, and it is these P's are planning for continuity. Then there are two P's which indicates an arrow indicates the planning for continuity. This is the classical P process. Then there is a new P process as well. So it is the steps are analysis, strategic designs, development of and testing, implementation and monitoring, then evaluation and replanning, and then there is a capacity strengthening. So some new things have been added. Now, these are all the concepts of communication strategies, and now another is a concept is effective communication. So for this effective communication, 7 C's are used. This is for effective for oral and written communication. Principal provide guidance for choice of content.
Now we will discuss the 7 C's of effective communication. As you know that communication is a two-way process, and through this process we share the information about the health issues of the public with the audience. The audience is that the target groups, and we formulate strategy. First we find out the problem, then we formulate a strategy, then we go for action. So it's a communication is to exchange of the information to the public or to the people, and then the feedback. It's a two-way process. And how we can transfer the information effectively, there is the 7 C's method or model, and this is effective for both oral and written communication. And the principal provide guideline for choice of content and the style of presentation, both the content and the presentation. And this is adapted for the purpose and to provide the receiver the excellent message. Then what are the 7 C's of effective communication? So this is number 1 is completeness, conciseness, consideration, concreteness, clarity, courtesy and correctness. Now we will study this. I will tell you under these headings the detail of these 7 C's. Now what is completeness? So by definition, completeness is a message is complete when it contains all the facts the reader or listener need for the reaction desired by the provider. Whatever we want to communicate, the message must be complete if it contains all the facts which are to be provided to the reader or to the listener. And what are the benefits of completeness? The benefit is we have to achieve the desired result without further expense on. When our message will be complete, there will be no further expense. And the messages these are to the building, plus the second benefit is to building goodwill. and the third is turn away costly lawsuit. Then how we apply the this completeness for the message, and we answer 5 W's, that is, in reply of inquiry, answering all questions, give something extra when desirable. So then is the applying show me this attitude toward reader and give information that pursued to the visitor. So you have to what the audience want, you have to transfer full and in a clear, complete way, and you have to cover all the required answers plus something extra. Then is conciseness. Conciseness, by definition, it means to be point, not brief, but in fewest possible word are relevant according to subject matter. First, the words must be few, whether spoken or written, and must be according to the subject matter. You know, no overdoing, no lesser doing, no irrelevant things. So what are the benefits? It save time and expense, definitely. When you have to speak or write less, and you will talk relevant, so it will save your time and expense as well. And then is to you may increase repetition by not culturing their professional lives. Now, how we apply this conciseness? So we eliminate wordy expression, that is, use substitute words or inactive voices. You have to use smaller words which are substitutes of the longer words. Then you include any relevant material. So we have to avoid long intros, unnecessary explanations, and excessive adjective phrases, etc., etc. Then how we apply this conciseness, the third form is we avoid unnecessary repetition. For example, you can say, instead of Capital Development Authority, we can use CDA, Multan Development Authority, MDA, Pakistan International Airlines we use, EIA, we can use abbreviations and pronouns wherever necessary. Then is consideration. By definition, consideration is putting yourself in their place. You have to wear someone else's shoes, and you focus on you in place of I or we, and this stress the positive in your message. Focus on the attitude instead of I, number one. Then show audience benefits or interest in the receiver, and then emphasis positive and pleasant fact. So this is about consideration. Then is the concreteness. It means be very clear in thought and expression, and must base on facts and figure during writing a message. Very clear in thought. Whatever you are writing, you must be clear in mind what you are conveying. And so then by this you have to use specific facts and figures. You must, your verbs, your sentences must one put action in the sentence. And then you choose image, building words, and etc. for this concreteness. Then the other C is clarity. Clarity, as its name indicates, it is using words that are familiar to the message of receiver. If I don't understand a language or some slang or some word, a message delivered to me will be of no value. So someone who wants to, communicate me something, he have to, he has to speak in my language, as to the language or to the words I am familiar. So one has to choose the precise, concrete, and familiar words and construct effective sentences and paragraphs in writing. Then is the courtesy. Courtesy is the word you people already know. By definition, it is being aware not only of the perspective of others, but also their feelings. It stems from sincere you attitude. This is something concerned with the attitudes that you must respect someone's feelings and then be sincerely tactful, thoughtful, and appropriate, and you must be appreciative. And then, before the audience, what expression you should use must show the respect for them. You can't show disrespect to the audience, you have to give respect. And then is you must use the non-discriminatory expression. Then is the correctness. Correctness, as you know, it is proper check on grammar, punctuation, spelling. If you are writing to something, the language must be a standard language. It must be, that you are telling someone a story of the past, and if you are writing a future tense, so it will be of no value. So your grammar, punctuation, and spellings must be correct. Then you must use right level of language, and then you have to check accuracy of figures, facts, and words, and then the writing mechanics must be, acceptable. So this was all about 7 C's of effective communication, and if you follow all the 7 C's, your message will be excellently delivered and which will be useful and effective for the health promotion, education, and communication. Thank you.